Long Beach this morning, a medical center is evaluating a potential treatment for COVID-19. 4 coronavirus patients at MemorialCare Long Beach Medical Center are participating in the program.
If you're looking for a way to thank a healthcare worker during the COVID-19 pandemic, the Long Beach Bread Lab is here to help. Okay, so here's how it works. Head over to store.lbbread.com, choose how you'd like to pay it forward, and the next hospital worker who walks up to the Long Beach Bread Lab to place an order will receive that coffee, bread, or pastry free of charge.
When I found out about it, I was just surprised, and I was like, oh, well, who paid for it? And when I found out it was actually the community that was doing this, it just gave me that feeling again that our community is amazing here at Long Beach.
I think that everybody's there is just working so hard, and a lot of them are really tired, and just to be offered something free and to be told, oh, somebody in your community has bought this for you. You can see it kind of puts a pep in their step.
Prior to COVID and even now with COVID, it's been one of the most supporting things our community has done for us, and we just can't thank them enough.
A fond farewell to a COVID-19 patient who spent 5 weeks in the hospital. Cheers for patient Raquel Ramirez, discharged from Long Beach Medical Center today after 5 weeks in the hospital battling COVID-19. Medical center employees lined the halls for Raquel, who spent 3 weeks on a ventilator in the intensive care unit. Before departing, Ramirez shared selfies and hugs with several of her occupational and physical therapists.
I would say Mandy is one of the nicest, most caring people I know. Well, we're here today to honor our friend Mandy Barton, who's in charge of the nurses at Long Beach Memorial Hospital. And we're surprising her with just kind of a drive-by, and you see some people with bicycles, kind of a bicycle by, to just let her know how much we appreciate all she's done these last several weeks, how many long hours she's put in. We just want her to know that we love her and that we appreciate her. I would say she's like the best of a nurse. You know, she's got that professionalism, she's got that calm exterior, even, you know, when all hell may be breaking loose. She's calm, she's cool, she knows what to do, she knows what she's doing, she knows how to do it, and she's got a great heart.
A children's hospital in Long Beach is trying to make life easier for parents who have sick children. Miller's Children and Women's Hospital broke ground this morning on the new Children's Village, bringing together outpatient and specialty centers now all under one roof.
Been a long time coming, many years of planning, but the vision has been there for years and decades, and to see it finally come to fruition it's a great day.
And the hospital hopes to have everything up and running by early 2021.
Cancer survivors, patients, and caregivers created a human pink ribbon for Breast Cancer Awareness Month at Long Beach Medical Center. About 1 in 8 women will develop breast cancer over the course of her lifetime. The MemorialCare Todd Cancer Institute hopes the pink shirts and the pink ribbon will remind women of the importance of regular checkups.
Welcome back. I'm Alex Curry, and September is Childhood Cancer Awareness Month, and the Halos have teamed up with Miller's Children's Hospital in Long Beach to help raise awareness and give these kids a crazy, unbelievable experience. And today they rolled out the red carpet. They got to watch batting practice, meet the players, and enjoy the game from this suite. Now, Tahir is 17 years old. He was diagnosed with leukemia 9 months ago, released from the hospital at the end of June, and you got to meet one of your favorite players today, Shohei Ohtani. What was that experience like for you?
It was crazy. It felt like a dream. Like, I couldn't even believe it was happening.
How special to be able to share this with your family today?
It's really special. It feels like with all the hardships that we went through, it really feels like a reward at the end of the road. It's kind of amazing.
It's been really special to watch, guys. Now, all the players filled out these cards for the kids in the hospital to just spread joy and let them know that we're all rooting for them.
Alex, thank you so much. Nice of the guys to do that.
Leap Day. We've been talking about this a little bit. We are live at Miller Children's Hospital. Oh, look at that, with their newest Leap Year baby. That's our Leap baby. Oh, we're going to talk to Mama coming up later in this hour. She looks amazing. She just gave birth.
This is incredible.
Oh,
It's the first high five.
Well, if you can't get to the beach, there's a simple solution. You bring the beach to you, and that is what happened today as MemorialCare Miller Women's and Children's Hospital in Long Beach held its annual Beach Day Festival. The hospital carts in hundreds of pounds of sand and makes the auditorium a carnival-filled seaside paradise. As part of the fun, therapy dogs, a bubble show, and anything that can turn a hospital into a very different kind of place.
And it's such a special day for all of our patients and families. We know that they miss out on a lot of summer events when they're here in the hospital, so we try to bring a little bit of that fun and excitement of going to the beach or going to a picnic or a party, and we have it here at the hospital for them in this wonderful auditorium space.
And helping out today, community partners like the Long Beach Fire Department and the Long Beach Aquarium of the Pacific and more.
How cool is that?
Yeah.
A hospital in California is spreading holiday cheer. Check this out. Newborns born during the holidays are dressed in Christmas stockings. This is at MemorialCare Miller Children's and Women's Hospital in Long Beach. The nurses there are posing while holding the babies they help to deliver, and you can see they're all wrapped in stockings. The hospital has been putting newborns in their first Christmas stockings for more than 50 years now. The ultimate stocking stuffer.
Yeah, what a photo op out there.
Yeah, right? Perfect size.
Antiviral drug showing some promise in fighting the coronavirus. Report from STAT found remdesivir has helped most patients in a study in Chicago. New study in the New England Journal of Medicine found about 2/3 of patients with bad cases of COVID-19 saw improvement with the drug at UC Davis and other hospitals around the world. Infectious disease specialist Henry Sue at MemorialCare at Long Beach Medical Center tells KNX he's hopeful some kind of treatments can be used to help people.
It's been extremely difficult to treat, and I think most of us clinicians have been shocked by how long it takes for people to get better and how severe their disease is.
4 patients at MemorialCare Long Beach have been treated with remdesivir. It's part of a larger clinical study.
Aches, exhaustion, shortness of breath, some sore throat. Sounds a lot like COVID-19. He asks, is it possible I actually had coronavirus? And it also showed positive on a flu swab.
So if it showed positive on a flu swab, he probably had the flu. Individuals who have COVID-19, generally they have a negative flu test, and then they're tested for COVID-19. That's usually the standard of care. So if he was positive for the flu, then it was most likely the flu.
So just maybe a follow-up to that. If somebody went to the doctor quite sick maybe a few months ago, they weren't testing positive for the flu, just for maybe an upper respiratory issue, that possibly could have been COVID-19.
Correct. It could have been. So if they did have it and there was a concern, as long as they've recovered and have been asymptomatic for at least 14 days, then I think it's safe for them to go back to their usual life, assuming they're still social distancing. But if they've been symptomatic free for 14 days, I think then they're okay.